And when many of her village mates saw her, they silently walked by, wondering if she was cast and destined to an early grave. Roselyn Wanyama has been living 12 years of her life with a growth that totally distorted her look and cut short her schooling. As Dr. Mercy Korir reports in this week's Health Digest, there is hope for Roselyn after a radical jaw surgery. We'd like to warn our viewers, though, that some of the images may be graphic and viewer discretion is thus advised.
When we met Roselyn at Ward 5 at the Kenyatta National Hospital, she was as jovial as anyone else, chatting with her well-wishers and not letting her big mass that she has lived with for the past 12 years get in the way of her day-to-day life.
Nilianza kuanzia kama niko na 12 years. Nilianza katikati ya meno, kitu ikaanza kufura hapo, alafu ikapanuka.
Roselyn, at 24 years, is a mother of one, a 2-year-old boy. Despite her massive jaw swelling, nothing has changed much.
Sasa labda nikitafuna, ndio nasikia uchungu saidi moja ya huko. Alafu meno ya ndani ilitoka.
Because of the progressive growth 8 years ago, Roselyn unwillingly left school.
Nilifika class 7, nilikuwa naingia 8. Nikaputu wakati nani mwalimu akaniambia enda home utupia kwanza ndio urudi shule. Sasa hapo ilikuwa 209.
She was admitted at the hospital after Dr. Adeline Vilembwa saw an appeal on Facebook for a condition well within her competence to manage.
Clinically and pathologically, it's what we determine to be an ameloblastoma. It's a slow-growing tumor. Usually doesn't pain. And if they come early, we could actually just find them incidentally on an X-ray.
Who exactly is at risk of getting such a tumor?
It doesn't happen in everybody. You can't tell who will get it. You can't tell who will not get it. So it's a benign tumor. It's not cancerous at all.
After visiting several hospitals in Western Kenya without much help, Roselyn is lucky that well-wishers came in and the doctors can operate on her.
We are going to do a resection right from the angle of the mandible on this side to the other angle with a margin at least of 1 centimeter to make sure that we don't leave any tumor because it can recur. And we also intend to do a microvascular free flap from her foot. So we'll use bone from her leg to reconstruct her mandible. And we are also using an implant, what we call a pure titanium plate for her mandible. So we will shape it and also shape the bone so that we give her form for her face.
After the surgery, Roselyn hopes to do one thing.
Nikisaidiwa nitoke huko Kenyatta, nitarudi shule tena.
Wednesday, 13th of September at 10 a.m. The surgery to remove the tumor kicked off after an intense early morning briefing. It's been 5.5 hours and finally the tumor is out. Almost 10 hours to go. Dr. Vilembwa, what next?
Now, this actually forms almost her entire lower jaw. So what we are going to do now is put the titanium plate to exactly where her lower jaw needs to be. And also, once Dr. Kahoro is done with the free fibula from her foot, that bone, we will put it inside the plate that will actually now form her lower jaw.
As the delicate operation to remove the tumor went on, the plastic surgeons were getting part of a bone from her leg to form part of the new jaw, together with the titanium implant. This multidisciplinary team of doctors, after the complex and extensive surgery, are optimistic. They not only hope to restore her physical appearance, but also to give her a new chance in life and to fulfill her dream of going back to school. Dr. Mercy Korir for Health Digest, KTN News.
A procedure that is absolutely going to change the life of this 24-year-old lady. And remember, later on the second part of the bulletin, that is from 10 p.m., we shall be speaking with one of the doctors. They're actually the lead doctor that conducted that surgery together with our Dr. Mercy Korir, just to understand more about this condition and how that